Tough discussion we got today, but it's one that needs to be talked about. Suicide Prevention Month, September Suicide Prevention Month. Sadly, 21 families have been through the pain of suicide so far this year. 22 people committing suicide in our county at this time last year, and the folks that came into our studio today to talk about it, Paul from Comprehensive Healthcare and Alicia from Safe Yakima Valley, folks that are involved heavily in this prevention effort. Good morning, you guys. Pull up to the microphones. Get close to the microphones. And Paul, this is an important, tough discussion. I don't even know where to start, but you say just talking about it makes a difference, right? Just talking about it.
We again think about it as parents. We have difficult conversations with our kids all the time. We have to talk about, what does it mean to use drugs?
Yeah,
it's drinking and driving. How do you make responsible sexual choices? This is one of those topics that we also have to have the confidence to bring up with our kids and ask the question if they're looking distressed. Open the door and make sure we have the opportunity to say, are you thinking about harming yourself? Are you thinking about killing yourself? And they can say no, but if we don't open the door, we're never going to start the conversation.
Where do you go from there? I mean, when they say no and we walk away and say, oh, okay, everything's all right. I mean, do you keep bugging them, or how does that work? Yeah.
How many times do you have to ask?
Yeah.
And like most kids, they don't know what you're going to do with that information, or adults, we don't know what you're going to do with that information. And so if I say to you, yeah, I'm thinking about suicide, are you going to lock me up? Are you going to put me somewhere? And so there's that fear about, if I share honestly with you what's going on, I don't know what's going to happen. And so sometimes we just need to continue that conversation. And one of the best ways to ask the question is actually to preface it with something like, Lance, you've been really, looking distressed recently, and you've been going through lots of challenges. And I'm aware that when people are in a place like that, sometimes they think about suicide. I wonder if you have. And so prefacing it by saying it's pretty normal to think about it, and we need to have the conversations while people are thinking about it so we can interrupt it before it progresses to action.
Is it common to think about it?
Yeah, if I were to put you in the front of 100 juniors in high school, and we were to say, raise your hand if they were honest. Raise your hand if you've thought about suicide. What's your best guess as to what percentage of those juniors would raise their hand?
Yeah.
What's your best guess?
Half.
It's closer to 70 or 80%.
Yeah. Oh, really?
But if I'm the one that's thinking that, what I'm thinking is, wow, there must be something wrong with me. Wow, I must be crazy. When in fact, it's actually normal. That's actually a normal behavior. And so helping kids and adults understand that thinking about suicide is actually not that unusual. And again, opening the door to have that conversation before it progresses beyond that.
Alicia, from Safe Yakima Valley, what role do you play, does your organization play in trying to prevent this from happening?
So we are working with youth in youth drug prevention, as well as elevated risk youth. We have a mentoring program. And really, we were looking at the connection between drug misuse and the elevated risk of suicidal thoughts. For whatever reason, there's a connection there.
Mm-hmm. And with, 50 overdoses so far this year, it's a big concern here in our Yakima Valley, right?
Absolutely.
Yeah.
Yes. And so my staff and I actually took Paul's training through Comprehensive because we work with the youth, and we had a youth last year who had indicated they had suicidal thoughts. And so we wanted to be well equipped to handle those situations. And I also still think there's a stigma out there that it's not okay to talk about, or you're planting the seed if you talk about it. And we learned quite the opposite when we took our training with Paul. And so we really said, we need to get this message out there more frequently.
Paul, when people talk about it, you kind of just brought it up a little bit, and the kids are concerned someone's going to take them away. Or what's the law? What does the law say about that if someone needs help? I mean, they don't have to fear being taken away, do they?
Right. I mean, the law is written very narrowly. So we have our designated crisis responders, our DCRs, and that's their job, is to assess individuals and see if they meet one of three criteria. Are they a threat to others? Are they a threat to themselves, or are they gravely disabled, which basically means they're not able to meet their own basic needs, and their life is at risk because of that. And so if we put people in hospitals for thinking about suicide, we would need a lot more hospitals. We just don't have
Yeah.
to do it. So the person really has to be genuinely not able to keep themselves safe in the community. It's our DCR's job to do everything except place someone in the hospital. They're looking for every single least restrictive alternative. Can you go home? Can you be supervised? Can we engage you with outpatient services? What can we do besides hospitalizing you to keep you safe and in the community?
You tell us that 5 times as many people die by suicide than are killed in homicides each year in Washington State. Suicide rates nationally have dropped on average in the last year, but rates for some groups like adolescents, LGBTQ, and youth, Native Americans, African Americans are increasing. Do you see that?
Yeah, I mean, so if we look at the data, we see that there's been a slight drop in the past couple of years with rates nationally, but there's been disparate impacts across groups. Here locally, one of the groups we're particularly concerned about is female adolescent Hispanics. That their thoughts and attempts are increasing based on data we're seeing from youth at risk surveys in schools.
Wow.
And so, yes, we're excited that the fact that the overall rate's going down, but for certain groups it is not.
I've got a question just about something you said earlier that concerns me just a little bit. I mean, obviously this is a really important issue. The numbers have increased. I mean, we're talking about a lot of the folks that are committing suicide are teenagers and young people.
Down to 10 years.
We've all had trauma in our life, whether we had a breakup, a divorce, a death in the family, a loss of a job, that where we may have had the fleeting thought.
Yeah.
That's not the same thing you're talking about, is it? Because I don't know about sending the message that it's somehow normal to have those thoughts. And I want to make a distinction, or I'd like you to make a distinction between the garden variety, I feel like I want to die, versus somebody who's seriously contemplating suicide because they've got issues.
Yeah.
Okay?
So if it's your brain's job to throw out solutions, that's what it does. And so when I'm in a situation where I find I'm distressed, I'm trying to find a solution, and I don't have it, your brain's going to start throwing out ideas. And one would be like, well, you should kill yourself. But luckily, most of us have good frontal lobes going on, and the frontal lobes step in and say, oh, that's not really a good idea. That's kind of a quick solution, a long-term solution to a temporary problem. So let's figure out what else we could do. So that's where the drug use comes in. If when you're under the influence of drugs, your frontal lobes are one of the things that are impacted. So what do we use our frontal lobes for? Decision making, problem solving, delay of gratification, all of those things you need not to kill yourself are impaired. With adolescents, the frontal lobes are still developing, and so the adolescent suicides, some of them are quite impulsive. So there's not that sort of dwelling, building, getting to that suicidal crisis. Some of them can be quite impulsive, because as you said, we've all had experiences in our life, except when I'm an adolescent, I don't have that context. I don't have that experience. So breaking up with my girlfriend, boyfriend, that's world-ending, catastrophic. We know otherwise, but for that adolescent in that situation, it seems that way. So to be able to again start that conversation and say, hey, I know it's occurred to you, but let's talk through this. Let's look at other options. Let me loan you my frontal lobes for a while and see if we can come up with a different solution to the problem you're facing.
If a kid is having trouble at home because maybe the family unit is having trouble, there's trouble in the home, these parents aren't going to talk to their kids about depression, right? So would you say that in these instances where kids are contemplating suicide, is it more or less because of things that are happening at home?
Again, there's a wide variety of reasons and impacts about who I'm going to talk to. One of the conversations you may very well have with your kids is your son or daughter comes home and says, my best friend, schoolmate, told me that they were suicidal, and now I have to coach my child through that, because are they going to reach out to adults, or are they going to reach out to their peers? Who are they going to have that conversation with? And oftentimes it is going to be peers. There's been a number of times this past year where I've reached out to a friend's kids because they were in a position where they had this information and didn't know what to do with it. So supporting them and their family in working with that adolescent who trusted that person and shared that information. So we need, I talk about suicide is not a mental health issue, it's a public health issue, and we all have a role to play in preventing suicide. And so we need to have adolescents know about suicide prevention. We need to have trusted adults know about it. We need to have faith communities know about it. We all have a role to play in being able to respond.
There are instances where people are surprised by the suicide or the suicide attempt because they didn't think people were showing signs. A sad story out of Washington State University a few years ago where the quarterback committed suicide, and many of his friends and even family members said they didn't see it. That he must have been a master at hiding it. What are we looking for in terms of warning signs if somebody's doing that?
There's a number of things that we're looking for. And typically, individuals will communicate through words, deeds, actions, writing about their intent. We don't always see it, though, because many of the suicidal risk factors for adolescents look like withdrawing. It looks like flashes of anger. It looks like being an adolescent. And so how do you separate signs and symptoms from what normal adolescent behavior is? So really what we're looking for is changes. We've got a student who was doing well in school and suddenly is not. We've got an employee who's been performing well and suddenly they're not. We've got someone who's social and interactive and that changes. And so those changes in behavior, not just a one-day thing, but more of a pattern over time. We're looking for closure activities. I'm giving away my belongings. I'm getting my affairs in order. I'm saying, hey, do you want to take my pet? And so those things that are telegraphing to us that that person's not planning on being here.
Lance is trying to give away his couch.
Right. It's his favorite couch.
Shut up.
Is there something you need to share with us, Lance?
Yeah. Well, the Union Gospel Mission wouldn't even take it. So that's how bad it is. No, it has nothing to do. It has nothing to do with
that's what we gotta be worried.
What we're talking about. We're talking to Paul from Comprehensive Healthcare and Alicia from Safe Yakima Valley about suicide prevention. Just got a couple minutes left. Either one of you guys, what really needs to be said that we're not saying here? That are questions that we're not asking? Are we covering it all? Have we? What else needs to be said, Paul?
Alicia touched on this earlier that we're oftentimes afraid to have this conversation. It's a tough one.
Yeah.
And asking is difficult. Not asking is dangerous. Simply asking the question has the impact of lowering that person's risk for suicide. If they're not at risk, they're going to say, no, why? Why are you asking me this question? And that's kind of awkward, but that's fine. But when I've been asking the suicide question for 30 plus years now, and you get one of three responses. The first response sounds something like no, and they're maybe a little offended that you even would ask them that question.
Right.
The second response is no. I've thought about it, but I'm not serious about it. I probably wouldn't do that to my family. And the third category of responses sounds like yes. And when they say yes, their whole body relaxes because they have been waiting and waiting for someone to ask that question, to give them permission to talk about the distress that they're experiencing. Because the individual that's suicidal is ambivalent. They want to live and they want to die at the same time. So what we're doing with suicide prevention is opening that conversation, talking to the part of them that wants to live, building that up, because that will automatically shrink the part of them that wants to die.
And for me, on a personal level, I have two sons. And they had friends that had suicidal thoughts, but my house was kind of the house they'd all congregate in, and I could notice the changes in behavior, and awesome. had direct conversations with them. And as a result of that, our youngest son is very astute to that, and he actually saved some of his own friends' lives that he walked in on, and they were in the middle of an attempt.
Wow.
And
jeez.
So the message is, as Paul indicated, we all own a part, whether you're a parent, an educator, a neighbor. Every life matters, and just knowing that someone is being told, my life matters, you matter, even in that right. moment if they don't feel like they do, can make all the difference in the world.
Gosh, what you said there is so true, though. I mean, sometimes it's somebody else's mom right. when I was growing up, that I could talk to, more than my parents. So, boy, if you're one of those moms or dads out there, and then the kids congregate at your house, it's time to open up those communication lines if you see something going on, right?
And the one trap they'll get into is I want to share something with you, but you can't tell anyone about this. And so we have to be able to say, I can't promise you that. but you can share information with me because I may need to call that person's parents. I may need to reach out, and that may feel like a breach of trust to them, and they may be mad at me, but they can't be mad at me if they're dead. So I'd rather have an angry live person in front of me.
That's right. A new suicide hotline in our state, right? Available now.
Yeah, nationwide, 988.
988. When I call that, what happens there?
You get referred to a bank of trained volunteers and professionals. They're going to talk with you and see if they can do some of the same things we've been talking about today.
Yeah.
Hey, let's brainstorm things. Let's talk about options. Let's talk about self-care skills. Let's talk about what you're doing to manage your distress. And if that's not enough, we're going to connect you with local resources. Could be one of our staff members. Have a conversation about whether we need to be, do you need to be in a stabilization bed for a period of time? Do we need to have you stay with friends and family for a period of time? Or do we need to detain you for a period of time? But that's kind of down the road part of the conversation.
I think this conversation is an important one. I think that we should have it like every 2 or 3 months. So we're going to keep in touch with you guys. I think these are great things that people just need to hear. And if we impacted one life today, if one person takes this action, it's kind of cliche when you say that, but hey, it matters. So, boy, if one of you out there use any of this information today, we did our job. Thank you guys for coming in. Appreciate it. You guys for coming in. Appreciate it. You guys for coming in.